that item into the record.
Chair Nelson and members of the board, departmental item number 1 is from the County Executive Office. It is to consider recommendations regarding COVID-19 health and human services recovery and resiliency strategies.
Good morning, Chair Nelson, members of the board. Can everyone hear me okay?
We can.
Great, thank you. Good morning again. This item is on your agenda for a presentation of the COVID-19 Health and Human Services Recovery and Resiliency Strategies. These strategies are designed to support and provide structure to ongoing and recommended recovery activities to specifically address the impacts of COVID-19 on the vulnerable, under-resourced, and underserved within the county. Many of these individuals are directly served by our Health and Human Services departments. The board is not being asked to make funding decisions today. Staff will bring a discussion of funding allocations and qualified uses of the American Rescue Plan Act funding on October 19th. However, the board may wish to provide some direction regarding the recommended strategies presented to you today. Before I jump into the rest of the presentation today, I do want to acknowledge the work of your Health and Human Services department heads, as well as their management teams in the collaborative development of all of the strategies that you'll be seeing today. Specifically, Daniel Nielsen, Pamela Fisher, Wendy Sims-Moten, Joni Maiden, George Chapchin, Vonda Reynoso, and our Director of the Office of Emergency Management, Kelly Hubbard, who worked collaboratively with the team to develop the disaster resiliency strategies. Again, thank you to all of them for their work in the development of the strategies, and then of course, ultimately in the implementation of the strategies. Let's go ahead and go to the next slide. In regards to an outline of today's presentation, I'll be reviewing some of the current conditions, the COVID-19 impacts at a national level, as well as some of the local impacts identified by the department heads. I'll also discuss the overall guiding principles that led to the development of the strategies, some of our desired outcomes, and then of course, the larger term approach to the actual recovery focus areas and the strategies contained within, and then we'll talk about next steps in terms of implementation. Let's go to the next slide. In terms of the current condition, as you've heard many times over the course of the last 19 months via the presentations from public health and others, communities of color have been disproportionately impacted by COVID-19, both physically and economically. In addition, lower paying industries like tourism, hospitality, recreation, and agriculture, whose average earnings are typically below $45,000, have experienced a drop of employment ranging anywhere between 15 and 40%. Women, who account for about 80% of the total population who exited the workforce during COVID-19, and that 80% exited primarily due to childcare concerns. In addition, we saw an increase in many of the services provided through our county departments. Specifically, requests for CalFresh assistance increased by 3%, Medi-Cal claims increased by 17%, and we saw a stark increase to our behavioral wellness access line, primarily in requests for substance abuse services, and our overdose rates continue to rise. On the federal, state, and local level, there was some relief offered, certainly. Business loans and grants were provided. Here in our county, about 8,100 businesses received the Paycheck Protection Program assistance. These businesses reported employing almost 91,000 workers, or about 43% of our total workforce in the county. Again, hospitality, tourism, recreation, and agriculture primarily utilized this program. There were also rental assistance programs provided over the last many months, and business assistance from both the state and federal and local government, which I'll highlight in just a minute. And of course, our safety net programs continued, and unemployment benefits were expanded both through the federal and state government. There is some good news. Our economy is in fact recovering. We had a high of an unemployment rate in April of 2020 at 14%. Most recently, We dropped to an unemployment rate of about 5.8% in July, and then in August, 5.5%. And we soon anticipate bringing back to our pre-pandemic unemployment rate very shortly. You have another item on your agenda today that will be presented by Ray McDonald, and he'll also be discussing some of this data. Let's go ahead and go to the next slide. In terms of the recovery actions to date, the board took immediate actions to address COVID-19 and their impacts, as well as set a sound foundation for recovery and assist our community members. Specifically, in June, the board allocated $7 million to Isla Vista homeless housing as a result of an increase in our unsheltered population and encampments. Again, regarding the encampment strategy, the board very recently allocated funding for capital as well as ongoing services so that that community services could begin to more actively address our growing encampment issue. And also, you dedicated $1.5 million over 3 years to behavioral wellness to conduct a community-wide assessment of behavioral health and substance abuse needs. And I'll speak in just a moment to some of the activities that are occurring there. In non-ARPA recovery efforts, again, staff undertook the Isla Vista pallet homes within Isla Vista to address the unsheltered. And since then, those shelters have been moved to the Lompoc area to continue services. Project Room Key has been in place for many months, serving as of today 198 individuals, with 88 placed in permanent supportive housing and 31 individuals remaining housed within Project Room Key currently. Local business assistance grants were offered via the CDBG funding allocation, and local rental assistance programs continued throughout the county. Let's go to the next slide. In addition to those efforts, while you will not see specific public health recovery strategies listed today, I did want to note their effort as they have been engaged in the public health response efforts throughout, in addition to addressing infrastructure and other dedicated funding. So foundational to the work by public health to outreach and engage with the underserved and under-resourced population, they've been addressing equity and inclusion across all facets of their outreach and response. As part of their ongoing recovery efforts as well, they are continuing to address disparities in health incomes, eliminate service barriers, and address service and information gaps in order to continue their ongoing response. Let's go to the next slide. In terms of strategy development and how we began the work in identifying the strategies presented to you today, we undertook several different approaches. First, we took a look at the national trends, and we'll be presenting those to you in just a moment. Each of the departments also reviewed the local data, local trends, and the various events occurring within each of the programs that they provide. We then convened to discuss direct and secondary impacts and challenges associated with COVID-19 and following service delivery. We then developed 6 recovery focus areas and developed the primary impact and future strategies that you will see later in the presentation. Next slide. In terms of the nationally identified impacts and challenges, I'm sure this will look very familiar to many. Of course, there were the physical impacts, obviously the morbidity, mortality, and indirect health impacts surrounding COVID-19, the socioeconomic factors, loss of wages, unemployment, impacts to education, housing, and basic living needs. Psychosocial, many had social isolation for the first time, increased stress, behavioral health needs, increase in substance abuse, family and domestic violence. And then if there were institutional and structural impacts as well. Impacts to the health systems across the nation, safety net strain, racism and xenophobia, as well as health and social inequities, as I mentioned earlier. Let's go to the next slide. I hope you can see this on your screens. I know it's in fairly small print. This is what the Health and Human Services Department specifically identified in terms of impact seen throughout our programs and throughout our community. We identified a number of the different areas so that we could craft strategies specific to address these impacts. Obviously, in the area of children, loss of social connections that are often developed within the schools, marginalized and underserved and under-resourced communities, as I mentioned before, were more severely impacted as a result of the pandemic. We saw incidences of family violence with greater risk of family violence due to isolation in homes. We also saw behavioral health and social connections, reports of loneliness. Twice as many adults reported feelings of anxiety and nervousness. We also saw loss of community connections. Women, we saw as well, were being exited from the workforce. Primarily, they were the primary providers for childcare, as I mentioned previously. In the area of homelessness, obviously we saw our increased encampments and increased and unsheltered homelessness throughout our system. Another area was digital inclusion. There was a lack of resources available to those to immediately access the internet, to participate in services and gather information. Disproportionately impacted adult learners and those who depend on public facilities to access the internet and online information for services found it very difficult to access a number of services, not only those provided by the county, but through other service providers. The elderly or people over 65 who had chronic medical conditions were, of course, impacted tremendously by COVID-19, and they also reported high instances of isolation and loneliness. Let's go ahead and go to the next slide. So our goals as we move forward is to set forward a number of desired outcomes for the plan. And those are listed here. The first was to address the most significant and primary and secondary impacts of COVID-19. The next was to integrate whole community practices to identify capacities and gaps in achieving equitable recovery and resiliency. And when we say whole community, what we mean is by actually reaching out to our community and understanding their needs, surveying them to understand to ensure that we're incorporating their needs into the planning. We also built recovery teams to drive recovery strategies and monitor trends. You'll see in our implementation that we have a department head assigned to each of our strategies so that they can continue to resource and drive strategies collectively. We also wanted to ensure that one of our outcomes was the ability to drive innovative, rapid, and inclusive recovery activities, which is why we're structuring the plan in the way we have. Our overall goal, of course, is to improve equity and inclusion, livability, wellness, and economic vitality with the outcomes that I've also listed here. Let's go to the next slide. In developing our strategies, we also wanted to ensure that we were using the values that we have crafted as part of our Renew 2022 effort. Equity and providing needed support to individuals, that there is better access to high quality services and resources. We wanted to ensure inclusion and a focus on initiatives that make Santa Barbara County a place where all can recover and thrive, regardless of race, ethnicity, gender, and age. We wanted to ensure that we were looking at innovation and harness the advancement and capitalize on Renew 2022 and what we have all learned in experiencing COVID-19. And lastly, we added sustainability. We wanted to seize the opportunity to address the goals that we've outlined in Renew 2022, modernize county services, and strategically deploy resources efficiently and responsibly, again, to be consistent with our organizational values. Next slide. This is our roadmap. And it kind of tells you where we've been and where we're going. Obviously, we started in phase one, which was to protect the health and safety of our community through those initial robust public health response activities. And we've listed a number of the actual activities here. We then moved into phase two, which I referenced was really establishing the foundation for recovery through our vaccinations, rental assistance, local and state programs, our outdoor dining, which I didn't comment on earlier, but which is critically important to our business recovery. And then, of course, getting all of our services online and following the Beyond the Blueprint strategies. Obviously, phase 1 and phase 2 continue. And now we're coming forward with what we're calling phase 3, recovery in a resilient state, which is the health and human services recovery strategies to improve equity, inclusion, livability, wellness, and economic vitality, all the while continuing to focus on equity, inclusion, innovation, and sustainability. Next slide. Our recovery focus areas. As I noted, we have developed 6 recovery focus areas, and there are a number of strategies contained within them. However, rather than developing specific department initiatives, this framework identifies the 6 recovery focus areas with related strategies and ultimately integrates programs and services among departments. Addressing the recovery focus areas will require more collaboration, cross-departmental initiatives, rated recovery grant funding, and community engagement strategies. As I noted previously, a department head is designated as a recovery focus area lead to ensure that these strategies are in fact executed and completed. Our office is reviewing the entire plan and ensuring overall implementation. The COVID-19 recovery focus areas were identified to ensure that current and future services will not only support all individuals throughout the current crisis, but will lift the marginalized and underserved above the pre-COVID-19 experience, and ensuring that all are prepared to quickly overcome challenges and also have equitable access to services and build opportunities to thrive within our community. As noted, the recovery focus areas are behavioral health, economic development and revitalization, disaster resiliency, housing and homelessness, organization and technology, and community health and well-being. Next slide. The first recovery focus area is behavioral health. Here, our goal is to guide anyone who needs mental health support and substance abuse treatment to know where to find assistance and how to access support. Our primary impact strategies for year 1 are to assess community need and establish appropriate service strategies. And secondly, to establish board and care beds for underserved and medically fragile seniors. Our first strategy has already been addressed. Thank you very much to the board for your allocation of $1.5 million over 3 years in Arpa funds several months ago. Because of that early allocation, our behavior wellness department, being led by both Pam Fisher and supported by Suzanne Grimacy, have initiated the community assessment. To date, we've received almost 4,500 responses to the survey. 35 agencies have been included and partnered with as a result of the outreach. We've utilized 18 promotores to ensure that the survey was distributed in Spanish and Mixteco. So that survey actually closed on September 30th, and the various stakeholders in behavioral wellness are now in the process of reviewing those assessments to determine next steps in development of services to address the needs identified. The next area, establish board and care. We're specifically looking at some strategies to establish a 15-bed facility to specifically address the medically fragile and underserved mentally ill within the community. This was actually reported to the board at the discussion of the capital facilities needs with behavioral wellness. The director of behavioral wellness will actually be leading this strategy as well. Let's go to the next slide for more specifics. As noted here, we have our strategies. The first, the community-wide assessment of services, as I indicated, the $1.5 million as part of this was already addressed in year 1. And we'll be assessing the needs to determine what will be needed in terms of future services along with our partners. The board and care facility for medically fragile seniors is a $700,000 one-time investment in rehabilitation. And then we will be looking forward in years 2 and 3 and future years for sustained service funding. We believe that this will be covered. The ongoing services will be funded not only through the CalAIM program, but through Medi-Cal and Social Security. So we do not believe there to be ongoing costs in year 2 and 3 to the general fund. In future years, we'll be continuing to explore school connections for services and expanding collaborative grants with our school districts. The $900,000 noted here is to expand clinical services to further support the schools. And the fourth strategy is an expansion of our substance abuse assessment services with $100,000 in years 2 and 3 to conduct an additional assessment. Next slide. The next area is community health and well-being. In this area, our goal is to ensure that underserved and marginalized within our communities have access to county health and human services. The first area is that, or the first strategy, that we're suggesting is assessing food security needs with an emphasis on senior nutrition. This area, based on our community dashboard, continues to be a very volatile area with food insecurity needs still spiking at different components of the pandemic. Our second strategy is to conduct a CalAIM readiness assessment to ensure that we can fully roll out a whole person care system required via CalAIM. And this also anticipates an IT plan. The next strategy is to establish a position to coordinate health and human services equity and inclusion throughout all the departments. We envision creating a health and human services equity hub to serve as a clearinghouse for all of the efforts among the various departments, not only in health and human services, but throughout the county. We want to expand outreach to underserved communities through the Promotoris program. We've been using Promotoris throughout our response to COVID-19, and we want to continue that work and institutionalize it within the organization. This strategy would allow that to occur. And we want to do a broad survey of families to assess child care needs and determine from there additional strategies moving forward. Our lead in this area will be our Director of Social Services. Let's go to the next slide. Next slide. No. Oh, I think we went back up one more. There we go. Thank you very much. Okay, so our first area, the assessment of the senior nutrition programs is about $150,000 for the initial assessment. And then for the future years, in case there are needs identified, we are proactively indicating a need of about $450,000 in case we have to expand that program. CalAIM and information technology assessment, $400,000 one time in year 1 for the actual assessment. In years 2 and 3, you'll see $800,000 within that column. That is specifically for case managers and navigators to allow people to work within the various regions of the counties, I should say, to help navigate people throughout the system so there is a no wrong door to any of the health and human services programs. The next area, as I already mentioned, is the Health and Human Services Equity Inclusion Coordinator position. In year 1, there is $100,000, knowing that we're partway through this fiscal year. And then in future years, we have the funding for the position to continue. We also have the outreach services, the $50,000 to help fund our Promotoris going forward for the remainder of this year, and then ongoing funding in years 2 and 3. And then in area 5, our child care survey of families within our community. We do have year 1 listed at $100,000, but we have found funding available through the state allocation, through the State Department of Education to First 5, and we have identified this funding, so we are not going to be requesting that in a subsequent board meeting. Let's go to the next area. The next area is economic revitalization and employment. And again, you'll be hearing from Mr. McDonald a bit later today with much more detail in this area. So our goal here is to explore innovative economic opportunities and regional partnerships to advance economic vitality. One of the primary strategies listed is the development of the Comprehensive Economic Development Strategy, which you had a report on several weeks ago. We've included the cost of that study within this report so that we are linking everything together. The next two strategies, the development of a strategy for use of anticipated federal and state funding for workforce development, as well as providing technical assistance to our local community, is also included. Again, these will also be leveraging the actual SES report once that is completed. The Assistant CEO, as well as the Director of Social Services, will be leading this effort. Let's go to the next slide. One more click. If we could go to the fiscal slide, that'd be great.
Carrie, just so you know, my apologies. There is a slight delay on our end. So we do see that here in the room.
Okay, great. Thank you, Jacqueline. I appreciate that. Okay, the first area, the Comprehensive Economic Development Strategy. Again, that was reported to the board previously. There's a one-time cost of $150,000 and listed here. That is our contribution, or the county's contribution to the total cost of the study of $450,000. The next two areas, the strategy for anticipated state and federal funding of our workforce, as well as the technical assistance I described, that is listed here at $1.1 million. We are not $1.1 million. We are not requesting that funding via Arpa. We believe that there is grant funding that will be available through the State Workforce Fund and the Workforce Investment Board grants to fund these activities. And again, Mr. McDonald can speak to these a bit later. Let's go to the next slide. Thank you. The next area is organization and technology. Our goal here is to ensure equitable access to technology and enhance digital literacy and inclusion to maximize utilization of county services and programs, as well as access to information. Our goal, again, is to also facilitate social inclusion of unrepresented segments of the population by advancing the use of technology in all of our communities. You can see here our three primary impact strategies: conducting a digital equity and literacy needs assessment and develop strategies to address, develop a long-term strategic plan for broadband deployment, which again, your board did hear a report on previously. And number three, to identify key data metrics and data integration across HHS departments. Here we envision developing a data dashboard to expand on what we already have represented within our public health dashboard that we've used throughout the pandemic. Last, our future year strategies is to maximize technology, extend Wi-Fi, and establish key hubs in the community or county facilities in underserved and under-resourced areas with community partners, again, to facilitate access to those that do not have immediate access to broadband. Our lead in this area will be our Director of Child Support Services. Let's go to the next slide. Here we go, itemizing each of the strategies. The digital equipment and literacy assessment, we anticipate to be approximately $100,000 as a one-time investment in the first year. Following up in years 2 and 3, depending on what is found within the assessment, the ability to invest in equipment, as well as training for individuals that may be identified so that they have their needs are met. Number 2, the long-term strategic plan for the broadband deployment. Again, this was discussed at the board meeting of 9/21, and that the funding of $200,000 as a one-time investment is included here. Number 3, which is the dashboard of Health and Human Services, identifying key data metrics that will evolve as part of our strategies, is approximately $110,000 as a one-time investment, and $200,000 ongoing until we can be fully trained in how to keep up the dashboard. We may need some consultant help moving forward for at least 2 years. We also want to maximize the technology to extend Wi-Fi, and we're going to be looking at that investment as part of the broadband deployment strategy. Next. The last area is one that has also been before the board, so this will look very familiar to all. Our goals here are to establish interim and long-term solutions for housing relief and sustainability, address keeping people housed, emergency housing, farm worker housing, and strategies to address encampments, ensuring health and safety. We have a series of recovery strategies. The first is to create 215 new permanent supportive housing options. We are doing that through the use of vouchers, and I'll describe the financial components of these in the next slide. Our second is to create an encampment strategy, which your board has had a report on and provided funding to date. We plan to increase temporary sheltering capacity by 100 beds, expand the continuum of housing options consistent with phase 2 community action strategy, ensure housing supports, working with tenants, homeowners, and lenders, maximize use of our multidisciplinary teams in the field, and expand our outreach, engagement, and caseworkers. Our lead in this area is our Director of Community Services. Let's go to the next slide. Okay, I'm going to go ahead and move through that as the slide is changing. So the first is to create the 215 permanent supportive housing grants. We do have funding allocated for year 1 through some specialty state and federal funding. We are also examining future funding for the vouchers through state and federal money, as well as looking at the state specific home funding for Arpa. And Jacqueline, has that slide moved? On my end, it has not.
Could you hold on one moment, Terry? We are, it's showing in the room, but it's not showing on CSB TV. Could 1 second.
Thank you.
Yeah, Terry, my apologies. I believe there is an error in our network or a slow network this morning. We are seeing it in the room, and that is what is being broadcast to the board members here, but I'm just confirming with CSB TV that it's the same thing that's being broadcast at home as well.
There we go. Okay, thank you. I'll continue to move through. All right, the next area is implement the encampment strategy and mapping software. The board did allocate on August 31 a first year of funding of $645,000. In year 2 and 3, in order to continue the strategy adopted, we do show an ongoing need of $1.2 million for year 2 and 3. We are continuing to look at ongoing funding sources there as well, both state and federal grants. Number 3 is increasing temporary shelter capacity with the 100 beds that we've spoken to the board about in the past. This $1.2 million in year 1 is a one-time investment. This is the funding to address water and sanitation at the Bridge House site regarding the 20 shelters that were recently moved from Isla Vista to the Lompoc facility. The $4.9 million in year 2 and 3, I do have a detail on the next slide, and it is basically the service component related to the 100 beds. And we'll go to that in just a moment. Number 4 is expand housing options consistent with the phase 2 community plan. Specifically in this has not been presented to the board in the past. This is $3 million that we're looking at for a match to any potential home key application that we would be bringing forward. Those applications are due shortly, and we currently have a team developing strategies on several different properties and opportunities that we can bring forward for home key consideration. The $1 million in year 2 and 3 is the service component in the event we do need to match and provide for ongoing service monies. Both the $3 million and the $1 million is highly contingent upon the type of project that we are able to bring forward for recommendation, and we are looking at an assortment of options at this point in time. The next area is housing supports, working with tenants and property owners and lenders to prevent evictions. Knowing that a number of the recent supports have ended, This 900,000 is being placed in future years in the event we do need to provide some type of bridge and safety net to avoid any future evictions. The next area is the complex capable engagement with our multidisciplinary team. These are the ongoing staffed intensive outreach teams. Again, year one has been funded through a series of grants. Future years of about 5 million or 2.5 each year is an ongoing funding need. We are continuing to look for ongoing grants to continue that service as well. The last area is our outreach workers. We have again funded this fiscal year in year 2 and 3. We are looking for about $1.7 million to continue this service. We do want to take an in-depth look at this service provision and look at best practices overall, ensure that we are using the best model, the most efficient and most effective model when we are providing for our outreach services. And we do have the request for the ongoing services moving forward. Next slide. Great. This is the detail of the $4.9 million in funding that I had referenced earlier. It reflects the amount of funding that the board has already allocated towards many of these efforts, as well as how we have funded the year one in services. We're very much trying to ensure that we are braiding all of our health and human services grant funding in order to address a number of our homeless service needs. And then in year 2 and 3, we outline primarily a number of the different service provision dollars that are required moving forward. Let's go to the next slide. The last area is disaster resiliency. And we have a number of different strategies indicated here. The first is the implementation of incident management software. This would allow for cross-sector and agency sharing of information real time across various departments for situational awareness. We also have the establishment of an emergency public information outreach coordinator position with an emphasis on developing a bilingual train-the-trainer community education program. Our next area is to enhance public and private partnerships to coordinate countywide disaster recovery and response. This is a partnership that we're proposing. It is a no-cost partnership. It's basically a process that we'll establish with United Way to ensure that they're in first position and ready for recovery efforts via a series of MOUs. The next area is to create an emergency preparedness and response program for preschool providers to provide for first responder and essential worker childcare. This would address many of the current concerns that arose during COVID-19, specifically for our first responders and disaster workers who were not able to oftentimes immediately respond on scene due to childcare issues. The next area for future years is to develop systems to track and support COVID-19 recovery plan. We want to ensure that our plan is adequately tracked and all of our outcomes are effectively measured and our progress to achieving all of these strategies are addressed. So we have placed in future years the ability to track and implement the program. The next area is to update the Santa Barbara County Operational Area Agreement to support multi-area agency and response. And this is more effective systems to work directly with our cities through ensuring our MOUs are in place and we're working effectively with our operational areas. The lead in this area would be our Director of the Office of Emergency Management. Next slide. I'm going to keep going, assuming that it hasn't moved. So the fiscal slide talks about the purchase of the incident management software. This is a one-time expense to obtain and implement the software. The next area is establishing the emergency public information coordinator position. This has a 6-month allocation for year one of $100,000 and then future year allocation of $400,000 for the next 2 years. In year one, we would retain the staff, and in years 2 and 3, we would have ongoing staffing costs. and we would have a potential for an ongoing funding need in this particular area. As I mentioned previously, the bilingual train the trainer community education program would be overseen by this individual, and this person would also focus on whole community recovery and outreach into underserved community to ensure disaster preparedness. The next area is number 3. I again indicated there would be no cost to this. This is the MOU with United Way for support services of vulnerable populations through disaster, as well as working directly with direct relief. The next area, as I mentioned previously, is the emergency preparedness program for first responders. And that has a cost for plan development of about $35,000 and potentially $70,000 ongoing, although we're still assessing that overall need. And then the last area is the disaster recovery exchange of about $420,000. And this is a disaster case management system that 211 has actually already purchased, but they do not fully have the capacity to implement. This funding would allow us the opportunity to assist them in the implementation. The last area, number 6, is a $70,000 cost in future years. And again, as I mentioned before, that allows us to develop those MOUs and to bring in some assistance to help us complete that effort. Next slide. This is a summary or roll-up slide of all of the strategies, bottom line cost in year 1, about $6.9 million. And then in future years, years 2 and 3, $24.5 million. Again, it is the staff's goal to continue to look at other funding sources. We will be coming to you next week with some thoughts about the use of Arpa funding, and then looking to strategically braid funding throughout the implementation of this plan. Next slide. So the recommended actions today is that the Board of Supervisors receive and file this report on the Health and Human Services recovery strategies, provide any direction or feedback as appropriate regarding these strategies, and then of course the CEQA action. So that ends my report. I'm happy to answer any questions. We do have all of our department heads also available on Zoom, and I believe that Mr. Nielsen is actually in the audience up north. Thank you.
Thank you, Ms. Mosnisich. Questions from the board? Supervisor Hartman.
I think I have a lot of questions, but let me first start with, are we required to have a strategy for ARPA?
Terry, just let you know, Nancy Anderson is our Assistant CEO and Budget Director, and she's been responsible for our requirements for ARPA. So let Nancy answer that question.
Supervisor Hartman, through the chair, what we have to produce is a recovery plan based on your board's actions. So not necessarily a plan to this level, but it's very helpful for all of the reporting requirements that we're going to need. So it does help that all of this work has been done ahead of time, so that when your board takes action on any of these items, we include it as part of the county's recovery plan associated to ARPA.
So if I'm understanding correctly, we need something, but this is more integrative and perhaps more, I think, more thoughtful than we would see normally in other counties.
And that's exactly right. For any of these items that are evidence-based type activity, there's an additional reporting requirements that you have to have performance metrics and all of these things that Terry and the department heads have worked on in order to be thoughtful about this whole process. So those are exactly the type of things that we have to include within the recovery plan itself.
Are there things in this plan that we wouldn't be doing or wouldn't want to do necessarily, other than if it weren't for COVID recovery? Or does it integrate things largely that we're doing, but it pulls them together in a way that may have been siloed before?
Supervisor Hartman, I'll let Terry speak to that as well. I think it's both. There are things in here that are definitely integrating things we're already doing. And that's, thank you to the departments, and particularly to Terry Mosnisich for doing that. But there are also new things. And as we said, we've been talking about recovery probably since January, and Terry started pulling the departments together very early to look at what we were seeing and to try to address, like she said, the primary and secondary most significant impacts. So there are things in here that we had not proposed before, and there are certain things that we know were chronic issues that we're trying to address given the emergency.
Could you give just a few examples, of Terry or Ms. Musnich, of the new things, just so I have a better feel for that?
Yes, Supervisor Hartman through the chair. Yes, thank you to CEO. She hit it right on. The elements that I would say are unique is where, and we've really tried to pull the thread through each of the activities, is really that focus on equity and inclusion, as well as outreach and communication and whole person recovery. So when you look at this plan, what you'll see is an emphasis on services to the vulnerable, permeating each and every one of the recovery areas. And that's also why you see represented in this report what we're calling the Equity and Inclusion Hub, in order to have somebody tasked very specifically with ensuring that we're using best practices across all of the departments and all of our efforts. So I would say that is a new aspect that hasn't been presented to you in the past.
I'll just make a little statement here. This reminds me a little bit of the Healthy Places Index, and that we're defining the 5 categories, I think, and trying to pull together our different programs under those categories and ultimately have outcomes, real results that we can measure and track over time. And I think it's ambitious, but I think we've been working towards this with Renew 2022 to get our departments in shape to be able to collaborate and to really bring a lot more transparency for the board and for the community to know what really does county government do. And so I'm very supportive of this effort, and it's hard for me to imagine how we're getting through COVID while also getting our feet under us to be planning for post-COVID. And I think the department heads and CEO's office really deserve an enormous amount of credit to have the bandwidth left to be thinking long-term while we're dealing with a crisis.
Thank you, Supervisor Hartman. Supervisor Hart.
Yeah, I think that's so impressive. I really want to give great kudos to Terry and all the department heads and Mona for having the bandwidth that I can't even imagine how you have the bandwidth to do this kind of strategic planning while the crisis is still underway, so that we are positioned for recovery in a resilient state. I mean, that really says it right there. That title of the focus of this work is so important. How are we going to get to a place where we're better while we're responding to the needs of the moment, and be more inclusive and more equitable in the process. And this is really impressive work that lays the foundation for that. One of the little details that I'm curious about knowing more about is on slide 19, where you're talking about the American Community Survey identifying 25% of respondents with no internet access. Is that in the underserved senior population, or is that a larger group of county residents?
Supervisor Hart, through the chair, what I recall on that is that it was primarily within a segment, and I'm not going to recall the exact population. It was several of our specific communities that were highlighted that lack that resource. And I can get that data if I can go through my notes.
Well, that would be helpful, because it is surprising to see things like that. But it's a reminder that, you know, the world we live in, that many of us, you know, are very comfortable accessing information, is not consistent across all communities in the county. And that is a real need that has to be addressed if we're going to rely on modern technology to push information out. You know, bottlenecks like that are significant. And we definitely saw that with the COVID information dissemination, still seeing it. There are challenges. The promontories and the other innovative ways that we've done to work around that have really successful and doing a great job. But these things in the long run, you need to be strengthened, and we need to do exactly the kind of planning and strategic thinking that you're doing to make sure that we have a system that works for everybody in the future when the next need arises. We're already have a massive fire in South County, and so there's not ever going to be a break. Probably we're just going to roll from one really critical moment to the next. And developing a system that is resilient and flexible and is able to adapt to the new challenges of the moment is super critical. And I'm so pleased. The temptation, I know amongst folks in the community and other governmental partners that we have, the state level, national level, is, we got a crisis, let's throw our money at it. And we struggle being on the receiving end of that. Number one, to make that effective in the moment. And number two, to make it sustainable. I mean, that is the biggest challenge for all these things, is there's a lot of good intentions at the state and federal level, the unmet needs that have become so obvious now in this time, and the resources are flowing in a one-time way. And yet we know when we do this work, actually, that's not going to be successful. We need to build a system that's long-term, and communicating that to our community partners and to the public is a real big part of this challenge as well, is how can we build a system that works not just in year one, but it works in year 5 and doesn't face a fiscal cliff that has all of us scrambling to fill. So thanks again for doing this planning.
Thank you, Supervisor Hart. Supervisor Lavadino.
Thank you, Mr. Chair. And I think this is kind of what happens when you say, so what are you guys doing? This is what we're doing. It's all of this stuff. So it's really cool to bring it into one report that really details it out. And I think Supervisor Hart had a great point of how we talk about the future, because you're right. We're relying on a lot of one-time funding that probably isn't going to move into the future. So it's important to let the public know that. I think it's also important for our strategy moving forward is to identify to our partners in the legislature that these are now our priorities. We have to talk to them about where the gaps are, where we can pick up, some of the load, but where we also see that, we're going to need help in the future if we're going to continue moving forward. So I thought this is a great presentation, and I will be using it as a tool in the toolbox for me when folks are asking specific questions about how we're responding to things. I think having it in one format really does help us quite a bit.
Thank you, Supervisor Lavadino. Supervisor Williams.
I have 3 questions. One is the big picture, piggybacking on Supervisor Hart and Lavadino's questions about sustainability. Is the guidelines for the second year spending broad enough to sort of allocate for some of these for sustainability 3 years worth of spending from ARPA?
Could you repeat that? And I'm looking at Terry.
Meaning, is the broadness of the dates by which we have to spend broad enough to, instead of fund some of these efforts from ARPA over 2 years, to fund them over 3 years?
I'm going to have Ms. Anderson respond to the timeliness. I understand your question.
And I can follow up after that.
And then the second question is more into the nuts and bolts. Is, can a board and care facility be located on the same campus as a, IMD beds?
Supervisor Williams, to the chair, I'll take the first part of that question, and then I'm sure Terry can follow up on the second. In regard to ARPA spending, we have to have the funds obligated by the end of December of 2024, but we have an additional 2 years through December of 2026 to actually spend it all. So we want to get it definitely budgeted and identified how it's going to be spent, but we do have until 2026 in order to actually expend the funds. So there is time to spread that over a 3-year period, and I believe that was Terry's intent.
Yes, and let me just jump on there and thank you. I was hesitating as I thought Nancy might give the first part of that. Yes, the way we've arranged this, we've really worked to put the most critical one-time funding to get started on pushing forward through some strategies via the initial assessments or investments in year 1, and then year 2 and 3, obviously those follow up. I will say, as I've mentioned throughout the report, outreach and engagement is going to be critical. Very specifically, as Supervisor Hart referenced with the digital inclusion strategy, we will most definitely, and we already have been reaching out to a number of the philanthropic partners and other agencies within the county to support us there, so that we are continuing to look at ways to make this all sustainable, or much of it sustainable. I will not say all, but much of it sustainable. In the area regarding board and care and IMD, I know Pam is on the line and she can correct me if I'm wrong, but I believe that yes, they can be housed in the same area or co-located, but there is a licensure issue. They are licensed separately as a facility. So if Pam can correct me on that if I'm wrong. Yeah, on same campus, but separate facilities because they're licensed individually.
And then my last question is, in cases where there's shared responsibility with another entity, and I'll just take, for instance, the 211 expenditure, are we basically picking up the whole tab or in this proposal, or are other, and that doesn't mean that we shouldn't do it. I'm just wanting to have my eyes wide open. Or are others contributing to that?
The Supervisor Williams to the chair, two answers to that. There's the ongoing 211 costs that are about, I believe that we're close to 180,000 now. The county is continuing to fund the vast majority of that. I believe a total of 140,000, if I'm recalling correctly. The other strategy that is included here, which is the expansion of the disaster recovery resource, is really an expansion to the usage of 211 so that 211 can also be in the position to serve in case management when we have a larger scale disaster. And that is all new funding that's recommended and included as part of the future year strategy. So that's beyond the day-to-day 211 hotline and tech services that we currently provide for.
And Terry, if I can assist.
Yes.
Chair and board, additionally, just to help clarify, that funding is the estimated funding for our county to implement the use of that program. So in order to use this software case management program that 211 has, there's this need for county, all of these health and human services and various departments within the county to be able to upload our services and resources into that system and to train our staff on how to utilize the system in order to therefore allow 211 to provide that support to our community members. And so that is largely associated with our estimate of what it would cost us to have someone help facilitate that process with all of our departments and get us up and running.
Thank you, Kelly.
Thank you.
Thank you.
My questions are somewhat piggybacked on my colleagues, just to feed off of that last one about other jurisdictions contributing. I know that many of these expenses fall squarely under the county purview of health and human services, but things like homelessness, are we seeing any of the other jurisdictions step up to partner with us on some of these ARPA funds? They have the same type of restrictions on the use of their funds. They're going to often be the primary beneficiaries of these funds. And I don't know what's coming out of the elected leaders forum or what the conversations are with the other city managers. But I'm really interested in seeing those funds be leveraged that the county spends with some of our neighboring jurisdictions. Any progress there, or what more can we be doing?
Chair Nelson, I'll start. I think we've had the conversation amongst the city managers that the county was willing to partner.
Mhm.
We weren't quite sure what that would look like or how that would be shaped, but we've made that offer that we're willing to partner with any of our communities. And I know the discussion, I believe, has come up just about what everyone can do in the elected leaders forum as well.
So I guess as we spend these, capital dollars or even ongoing dollars for these next 3 years, it makes sense that, we ask our, municipalities on how much of the response do you want the county to have in your jurisdiction and what we can leverage those funds to do. I think it's really important conversation. And I know that we have a lot of money that we need to spend. So it may be just easier just to power through, but I think we're missing a huge opportunity to work with our neighbors and actually build a framework while there is money available that could be continued beyond ARPA funding, where some of our municipalities can now make a commitment to funding things like homelessness services, especially since they're the jurisdictions that are often the most impacted. So I'm really interested in that moving forward. And my other big concern is, year 4. We look at all this stuff and what is where are we at that point? I don't want to see a fiscal cliff and layoffs and we make all this progress just to take a step back. I trust our capable staff that's going to be in the back of their mind as we move into this space, that, which positions that we currently have that can be repurposed into some of these new commitments that we make. I hear outreach caseworkers and engagement, and I think about eligibility workers and again, finding ways to find other staff that has very similar skill sets and trying to find ways to weave that into our entire program so it's sustainable, because I think the idea that when these dollars are up, that there's going to be another wave of that is probably an irresponsible position for us to be taking. And so we need to be thinking ahead to that. That's why my priority is, and more often than not, is to, capital investments, long-term investments that we can't do any other time. So we get that infrastructure in place that we can build upon those building blocks moving forward. I did see I think on slide 22, there's this some money that we're set aside to partner in additional capital services on state home key. My hope is that that's great. That's important. That's, leads to some permanent supportive housing, but we really need to continue to invest in the temporary shelters. We're going to be working on towards an encampment strategy, but if we don't have any place to move them to, I think we're going to, have that bottleneck. And I think we really need to bring up that level of service and make sure that we have the capacity and that we are moving forward with more than just what's already in place with, Isla Vista, Lompoc, and Santa Barbara. We need to have some additional locations countywide so that we can really reach those that are most vulnerable in our community and have the most impact on the quality of life in our county. And I think that these ARPA funds are a huge opportunity, and we cannot let that go. This is an opportunity to prove out that system that, if we eliminate these encampments, bring those people indoors, provide them with wraparound services and case management, will it work? Is it something that we can actually move the needle significantly? And I'm optimistic. It seems that other jurisdictions have done that throughout the country. And I hope that Santa Barbara County becomes one of those examples moving forward. So again, good presentation. Look forward to further discussion. CO.
Chair Nelson, thank you very much. And again, just want to thank Terry for pulling this all together. I also just want to remind everyone, in case people are listening, none of these strategies are fully funded. And it doesn't mean they're all going to be funded from ARPA funds either. But what we're presenting to you is based on our department's review of what they thought were the most important next steps in all these areas. And a lot of this will be asked of you next week. And when we look at all the different ARPA requests put together, and some of them do have ongoing costs for which we do not have funding identified, particularly in the homeless area. There are some things that we've already committed to, And we'll have a clear discussion with you next week about what we've already committed to, but yet have not funded. And those, I think, would be a first priority for your board to consider. But having said that, the purpose of the strategy is to come to you and for you to see what we're thinking, see what's going to be requested next week, but also that we are still going to look at other funding coming down from the state and federal government. And if we can't find those sources, if it is a priority for your board, do you want us to redirect funding at budget or use other general fund? I mean, those are kind of the main choices. But I do want to thank Terry for pulling this all together and all the departments who've helped.
Thank you, CEO Miyasato. Supervisor Hart.
Yeah, just I really appreciate your question about the Elected Leaders Forum on homelessness and how best we can integrate the work of our partner local governments on that challenge. And I'll be honest and say that partnership is still pretty new and fresh, and folks are learning about the work everybody's doing. And I think that's probably the most significant accomplishment to date, is that there's much better communication and understanding of the roles everybody plays and the need for our local government partners to be more engaged on this issue. But that's pretty new, and the money from Arpa isn't aligned perfectly with the evolution of that conversation, but it's part of the mix. And there's an understanding that this is a new opportunity and that money would really be helpful to this collaborative effort. But more communication and more work amongst us with our friends and colleagues at local governments around the county can only help that. So I would encourage anybody who's got some views about this to engage with their council colleague friends and say, this is really a unique moment. This is the time we should all step in together and move this ball forward, because it's going to take a new commitment to not just be engaged in the issue, but to put money on the table to make it work.
Thank you, Supervisor Hart. And I'd just like to add to that for a second. Supervisor Lavanino and I both do a radio show. He does it the preview before the supervisors meeting, and I do it afterwards on one of our local AM stations. And I was talking about this, and I said, hey, we have this funding available to address some of these big issues. And I look forward to having other jurisdictions involved in that as well. And I quickly got a phone call from one of those jurisdictions going, wait, what's this new funding coming from the federal government that we can partner with you on? And I said, what's your ARPA funds? And the answer was, oh. I think, though, it is a good chance for them and us to say, okay, it's not as painful, right? And it's an opportunity for us to do a proof of concept. If we can partner together right now, they have those ARPA funds. They are, there's always an opportunity cost. If they spend it on this, they can't spend it on something else, right? And that's what's always hard about it. And if the county's just going to take care of it, then why do maybe we'll spend it on something else? But I really invite our jurisdictions to engage, because then we're at the table together. We both have skin in the game, and I think that's where we're going to make some progress. And yes, that probably means when all the ARPA funding's finished, that we still need to continue those partnerships. But I think by having these funds available from the federal government, it's a good opportunity for us to kind of work through some of those kinks without having the same pain that if we were having to pull general fund dollars into something like that. And that there would be some, existing operational sacrifices, which may be necessary in the future, but it is something that we have to be thinking about if we really want to solve these issues and really make a dent in this. So, Supervisor Hartman.
Well, I think you raised some really good points. I think it's hard for people to get out of their business as usual mode unless they can see a benefit, a new benefit. I don't know whether our plan and being part of that plan could reduce the need for some of the other jurisdictions. How we can frame this as if they could piggyback onto some of our planning so that they don't have to generate all of this themselves. We through SBCAG, we already do work together across jurisdictions. We do it with libraries in a different way. We're thinking about broadband and now homeless. So we increasingly are finding issues that we need to work together, cities and counties, and we don't really have a structure or a way to describe the benefits. But in my life, unless you can put some benefits on the table that someone sees that they wouldn't get otherwise, it's hard to bring them into a partnership. So maybe we can think about that. I did have a couple other points I wanted to make while I've got the mic on. One of the things that I think we learned, or a couple things we learned during the COVID era was how significant partnerships were. And we mentioned the promotores, but there are, so many entities in the community stepped up and worked hand in hand with the county to get things done. And I just think that really deserves a shout out. I often say government can't do it alone, but when we can get a plan, a template, and then get everybody pulling in the same direction, it can really work. And I'm really proud of our county and what, from individuals to organizations stepping up across the board. The other thing we saw was communication and how critically important it is to have clear, consistent messaging going out. And I see that reflected in this plan, that lesson. The other thing, and I talked with Terry about this last week, but for me, one of the lessons was how important parks and trails and outdoor experiences are. That was important, I think, to keep people healthy and keep people sane. So I know this is more the health and human services piece of it, but I just don't want to forget that other part, because for health and well-being, being active is fundamental.
Thank you, Supervisor Hartman. And just to kind of respond to that, jurisdictions seeing something that it's tangible, that they can see that improvement. And I think that's where the encampment strategy comes in, because if they're the ones that are going to have that impact, they're going to have the blight, they're going to have the, potential environmental impacts within their community, public safety impacts. And if we can really address that by a shared partnership and really be united in that and making sure there's a capacity to deal with those that are in the most vulnerable position, I think, that's where we're going to see those benefits. And so that's why that's been my speech for a while, and I'll keep pounding on it, and hopefully we can get somewhere with that.